I'm sitting here with Denise, a nurse consultant who works in a medium morbidity state. So, Denise, how long have you been working with TB clients?
I've been working with TB clients for a bit over 20 years now.
All right. I'm interested in talking with you a little bit about the things that you like to do to prepare yourself to take an initial report.
All right, so take an initial report on a new TB suspect or TB case. It's, one of the things you need to do is make sure you have the appropriate forms in front of you so you collect the right information. You also want to get familiar with your community so you understand the network of providers that commonly call you. That's sometimes very good to know who they are because some know more than others and you know how to get good information from them.
And why is that preparation so important?
Well, just like anything else that you do in healthcare, trying to get all your ducks in a row so that you're able to proceed efficiently and effectively is very important. And kind of setting the pace for the people that you're talking to be a bit more relaxed in providing you information occurs if you have more confidence in what you expect to get from them.
Mm-hmm. That makes a lot of sense. So once you take that initial report, how do you prepare yourself for your first interview with a client?
It's true. Making a plan to see that patient for the first time, or that client for the first time, you kind of have a whole bag full of things that you bring with you to that initial interview. You'll have everything from a thermometer to a scale to containers to collect some sputum if you need to collect it. You'll have all the paperwork you need. But most importantly, you're going to really work hard on trying to set a comfortable environment for the patient. Mm-hmm. Building that rapport, giving them confidence that you are working with their physician will really set a very comfortable environment for them.
Mm-hmm. And what are a few of those things that you do to make sure that that client is comfortable?
Well, before I ever go see a patient, I make sure I give them a call or work very hard to give them a call so that they know that they're expecting me. Mm-hmm. I let them know that I've spoken with their physician and that we're both on the same page, that we're working collaboratively to try to make them better. I've asked them do they have any questions that are really pressing at this moment, because sometimes if you can just get some of those things out of the way, they know that you're on their side and you're really interested in what they're thinking. You acknowledge they're fearful perhaps, or they're nervous about income, or they understand that there's something happening here that is different than they ever expected. So it just builds and strengthens the relationship that you're going to need to carry on through the entire course of treatment.
Mm-hmm. Now I'm wondering, why is getting the right information so important in that first interview with the client?
We often have incomplete information when we get the initial report. So that initial interview helps us begin to build that foundation for developing a very effective nursing plan of care. If you don't have all of the information that's needed, you're not necessarily going to be able to carry out what's uniquely needed for that patient.
Mm-hmm. Mm-hmm. So we've talked about the care plan and developing that plan. Mm-hmm. Seems like there's a lot that goes into that plan. I'm wondering if you could tell us a little bit about some of the key parts to the care plan.
Oh, yeah. The nursing care plan can be expansive and it's ever evolving. It starts out relatively simple with some basic elements. You will have the treatment. What is the treatment regimen the patient is on? You need to make some determinations about whether they're infectious or not and how to deal with the contact investigation. You're also going to need to check and see if they need any sort of assistance when they get home. There's some adherence issues or financial issues that they might be concerned about. So this treatment plan grows from that initial interview, and the more information you get from them, the more unique and specialized that plan can be for that patient.
Mm-hmm. And I know we've talked a little bit about sort of really thinking through what some of their barriers might be when it comes to kind of following the plan.
Right.
Can you talk a little bit about that?
Yeah, tuberculosis, while it is a diagnosis, a medical diagnosis, has always been considered more of a social diagnosis than a medical one. The baggage that, and for lack of a better word, but the baggage that clients bring with them to you when they're diagnosed with TB can really set them up to not be able to successfully get through the long therapy that is in front of them. Mm-hmm. So these certain barriers to care could be something like mental health disorders, some substance abuse disorders, things such as alcohol. They could perhaps have some side effects or adverse effects from the treatment if they drink alcohol. The other thing is where do they live? What home? Do they have a home that has running water? All of those things can set a patient up for failure when it comes to getting through the treatment.
And you talked about their home, and I know that's one of the places where the plan really starts is
right.
really thinking about how you're gonna get that client home.
Right. Getting them home, it can be tricky. Very often the hospitals want to get them out as quickly as possible, but we do know as public health professionals that making sure their environment when they are released is safe for the patient and safe for the people that they're living with. So there are different mechanisms in place in different states that will allow you as the public health or the nurse case manager to really do a good assessment of the home to make sure it's safe, and then to make sure that you prepare the facility to provide those things for the patient before they're released from the hospital.
That's great. So once the client's home and the treatment is underway, what goes into managing that TB care over the long haul?
And the long haul is probably the right way to put it, because very often when people are started on antibiotics for a bacterial infection, they expect to take medication for 2 or 3 weeks. Treatment for TB is months long, sometimes years long. So there's some basic categories of things that we manage. One of them is we're going to monitor them for treatment of cure. And basically what that means is, are they getting better? Are their bacteriology results improving? Is their chest x-ray improving? That's monitoring for treatment of cure. Another thing that we do is we monitor for side effects and adverse effects, because these medications are quite toxic, and patients can have events occur that might cause you to have to stop the treatment or adjust the treatment. So we monitor for that. Another thing that we do, and very important, once again, is monitor for treatment adherence. And we use directly observed therapy in it pretty much for every single patient, but there's other things that you're going to learn about that they're going to help you kind of proceed through the management of your TB clients with a bit more ease.
Mm-hmm. So it sounds like there are so many moving parts when it comes to TB care. As you near the end of a client's care, what goes into completing treatment and closing the case?
You're right when you say that there's a lot of moving parts because people are not simple. There's a lot of complexity in every single one of us. We look to make sure they improve. That's, of course, part of determining whether someone can be considered completed. But we also need to take a look at whether they've had an adequate regimen over the length of time that's been prescribed. And that requires calculations of the dosing that they've taken, as well as the combined with the frequency in which they took it. Now, during this particular course, we plan on giving you plenty of opportunity to practice that, because that can be difficult. That's a difficult skill to learn, but it's very important, because unless you can be sure that a patient has completed the medication that was ordered, you can't be sure that your patient is going to be cured.
Mm-hmm. All right. Well, thank you so much for sharing your wisdom with us.
Well, it's my pleasure.